Hey guys, it's Nurse Gwenny. Let's talk about myasthenia gravis. We're just going to call it MG for short because it's a bit of a tongue twister to say. So, MG is an autoimmune disease that we see affect men more than women, and it typically onsets in about the fourth to fifth decade of life. So, let's talk about what happens in healthy individuals. These two chairs that I've got butted up against each other here are going to represent a neuromuscular junction. Junction just meaning where they come together. So the brain generates a message that it sends down through the nerves, and then where the nerve meets the muscle, the message that it's trying to tell the muscle is, hey, I need you to contract. I need you to pick up this item. I need you to move your leg so that you can walk, whatever the message is. Myasthenia gravis comes in and says, absolutely not. We will not be communicating these messages. And it blocks these acetylcholine receptors. Now, it doesn't block them entirely. These patients typically have some control of they're able to have some connections here at the neuromuscular junction, but it's greatly reduced. And so these patients present with a lot of weakness. It tends to be more weakness in the afternoon than the morning because it's almost like these neuromuscular junctions get worn out throughout the day. Now, the number one symptom that we see in these patients is ptosis. It's spelled with a silent P at the beginning, kind of like pneumonia and pterodactyl, right? Ptosis means drooping of the eyelids. These patients often will have facial weakness that will make it difficult for them to swallow or speak. And so these patients sometimes will choke on their food. Now, here's where it comes into play for you and I as emergency clinicians, right? Whether you're working EMS or in the ER. This also affects the patient's diaphragm. And so these patients can present in what's called a myasthenic emergency, where they cannot control their diaphragm to be able to generate that negative pressure inside their chest and draw in air. And as a matter of fact, I took care of a patient. I flew them one time. They had just been intubated by the anesthesiologist at this small facility, and I was flying them to a larger hospital with intensive care services. And it was the most difficult patient I have ever had to mechanically ventilate. And what I didn't know at the time is she had this big old mucus plug in her lungs that we were not able to ventilate past, right? We tried all of the things. We tried switching her to pressure instead of volume. We tried differentiating our pressures. We tried suctioning her. We tried so many things. And when we got her to the ICU, they immediately bronched her at the bedside and they pulled out several of these really deep, big, fat, dried out mucus plugs, right? They weren't wet so that the patient couldn't cough it up. And that was the problem with this patient. She didn't have the strength in her diaphragm to she'd been very weak for several days, and so she was building up all these mucus obstructions in her bronchioles. Now, a few things that I want you to remember if you encounter a patient in a myasthenic emergency that needs to be intubated. Where do our depolarizing paralytics work at, right? They work right here on those acetylcholine receptors to overwhelm them. Well, we just learned that these MG patients have an impaired acetylcholine receptors, right? That's where the MG is acting on. So succinylcholine is not going to be as effective on an MG patient. Now, conversely, rocuronium is going to have an exaggerated effect on these patients because the way it works is it just silences and prohibits that connection from going from the nerve to the muscle, what just happened to my brain, to the muscle. And so a much smaller dose of rocuronium is required for these patients. And if you hit them with a typical regular sized dose of rocuronium, you're going to see a prolonged effect. So they're going to be paralyzed more than that typical 30 to 45, maybe even 60 minutes that we see with patients that we give rocuronium to. So there's a little background on MG and what you need to keep in mind if you have to intubate one of these patients.